So good morning, everyone, and it's the top of the hour. Our presenters today have some great information to share with us, so I thought we would go ahead and get started at the top of the hour. For those of you that have not met, my name is Abraham Segrist. I'm the Vice President for Quality and Safety here at the Virginia Hospital and Healthcare Association, and would like to welcome you to today's webinar in our year-long series of improving patient experience in Virginia hospitals and health systems, celebrating 2020 as the year of patient experience. So a few housekeeping notes before we get started. This webinar is being recorded, and all of our participants are in listen mode only for the webinar. We ask that if you have questions or comments, you do so by typing those in the question box. The slides and the recording will be available on the VHHA Quality and Safety website by the end of the week or early next week. And then finally, a feedback survey will launch at the conclusion of today's webinar. Today's agenda, I will review some additional background information on our year of patient experience, and then very excited to turn the presentation over to our colleagues from Sentara Healthcare, Genemarie McGee, their Corporate Vice President and Chief Nursing Officer, and Cherika Britt, their Systems Director for Patient Experience. And then, as we always do, we'll conclude with polling questions and discussion led by our partner, Carrie Brady. So just a reminder, the VHHA is an alliance of hospitals and health delivery systems with a vision to make Virginia the healthiest state in the nation. The member institutions include all of those that are listed on the screen in front of you, from Augusta, to Centra Health, to LifePoint Health, University of Virginia, Inova Health System, and of course our colleague at Sentara Healthcare. The goals for our year of the patient experience include identifying, highlighting, and celebrating efforts by Virginia hospitals to improve patients' experience of care, to integrate and link patient experience improvement efforts with broader quality and patient safety improvement efforts, to facilitate connections between Virginia hospitals and health systems and other stakeholders for the purpose of shared learning around patient experience improvement, and then ultimately to support efforts to improve Virginia hospitals' individual and aggregate performance on national patient experience improvement measures. So without further ado, I am going to turn off my webcam so you're not looking at me for the duration of the presentation. And did I do that? I think I turned off the wrong thing. Are you guys able to see my screen?
What we see is VHHA Center for Healthcare Improving Patient Experience webinar with the PED information on it.
Excellent. So I am going to double check and make sure you guys are seeing the right image before we get started. I'm assuming you guys are not seeing a photo of our presenters yet.
We did, and now it's down. Now we see slide 1 of your presentation.
Well, we will.
We need to go to slide 8, Abraham.
Okay, let's see.
Who has the controls on this?
I've got the controls, and I'm like struggling it just a bit, but we're going to get it fixed.
No problem.
There we go.
There you go.
Perfect. So now it is my pleasure to turn it over to Genemarie and Cherika Britt.
Great. Thank you. Next slide. So Cherika and I are very delighted to be here today. As Abraham indicated, I'm a Corporate Vice President and the System Chief Nursing Officer for Sentara, and Cherika is our System Director for Patient Experience. It's a pleasure to be here. We are thrilled to just have a conversation with you and share what we've done in our customer experience journey at Sentara Healthcare. And we're going to show some of our design strategies and tactics that we've utilized to guide ourselves sort of down this practice. Next, Abraham. So here are the objectives for the presentation, and I'm not going to read them to you, but this is all about how we set up our program. That's what we're going to share, and how we have enhanced that program and continue to tweak as we go along, and how we tie that into what we call the experience of care, because I think as everyone on the line is aware, it's not just about the score. We are also focused on what kind of experience the patient has whenever they're in one of our facilities. Next. So just a little bit overview about Sentara Healthcare. You can see our mission, our vision, and our values. And then you see something under there called our Sentara commitments, and I'm going to come back to that in just a moment. For more than a decade, we have been ranked as one of the nation's top integrated healthcare systems, and so this presentation includes all parts of our system. And we are a not-for-profit system. We've been in existence for 30 years. We have 12 hospitals and home health and hospice. We have Sentara Medical Group in various places across the state. We have Optima Health Plan. We have Sentara Enterprises, which includes a pharmacy and has our home health and hospice and a medical transport. And we have quite a few outpatient campuses and services. So it is our mission to improve health every day, and we live by it and try and emphasize our Sentara commitments. So you see, all about that commitment involves what we do with our patients and families. Always keep you safe, always treat you with dignity, respect, and compassion, always listen and respond to you, always keep you informed and involved, and always work together as a team to provide you quality health care. So we really try and keep it focused on our patients. And this language really helps us articulate the why and reminds us all of our purpose and our service philosophy here at Sentara. Cherika, you want to do the next?
Absolutely. Hello, everyone. It is indeed a pleasure to be here with you today. Thank you, Genemarie. So I want to kind of talk a little bit about the model that we use for customer experience. And, hopefully some of this looks familiar to you, if not all of you. So several years ago, VHHA introduced a patient and family experience implementation guide that was based on research that suggests that hospitals that achieve exemplary patient experience share 4 common foundations, and you see them here: patient and family engagement, member of the team or staff engagement, leadership, and also effective use of data. So in designing our customer experience program, we felt strongly that if we positively impact these 4 foundations, we will in fact improve the experience of care. So if we advance 4 times, you'll see here that in each of the 4 foundations, we've highlighted a couple of tactics. And these are among many things that we have implemented. So we will review each of them with a heavier focus on that member of the team or staff engagement foundation. You will find that we felt that it was important to make sure that each of these slides is informational so that you can go back and review in further detail. Okay, next slide. So what we're going to do is we're going to start with our patient and family engagement foundation. First and foremost, in these challenging times, we know how important it is for us to provide comfort and also reassurance to our patients and families during a hospital stay. So with this, the Sentara family shifted into high gear, which I am sure many of you can relate to. So in supporting minimizing fears and anxiety, Genemarie, along with Dr. Joel Bundy, who is our Chief Quality and Safety Officer, were featured in a video that talks directly to our patients and families about measures we are taking to keep them safe and also support that critical connection that they need with their families. That video is shown with every admission on the television in their room. We are also very proud of our patient and family advisory councils, and those are in place in all of our hospitals as well as Sentara Medical Group. Our PFACs are, and we'll call the Patient and Family Advisory Councils PFACs for short, They are actively engaged in different committees across our divisions, and that includes our Complaints and Grievances Committee. And we've also established a standard that all system patient and family education materials are reviewed by our PFACs with input incorporated and also revisions made to make sure that we can say our educational materials for patients are easy to understand. So with all this, however, we have faced some challenges. We recognize a need to increase recruitment and ensure that our councils are representative of our diverse communities and that they're also aligned with diversity and inclusion aims. We also recognized a need during this pandemic to move to a virtual meeting platform, and that's in an effort to ensure that our PFAC members are safe while continuing the great work that they do. As we continue to envision what the future looks like, we are certainly working alongside them and incorporating their feedback every step of the way. So what you see on the bottom half of the screen here is an example of how we redesigned our PFAC brochure to highlight our diversity, our adherence to recommendations associated with COVID-19, and our move to a virtual meeting platform. Okay, next slide. So moving on to the members of the Team Engagement Foundation, it is our pleasure to introduce to you our Because We Care training and continuous learning program. So this program is the most unique opportunity in Sentara's history where safety and customer experience teams combined their efforts to focus on our Sentara commitments and also develop a program that provides interactive and experiential learning. So the objective with this is for every member of the team, no matter if they're clinical or non-clinical, to understand their why and also their purpose, and also to see how their role impacts the experience of care, and then arm them with the knowledge and skills to be most effective. During this creation of this program, it was a privilege partnering with our system safety team to include Dr. Bundy, to include Mary Morin, who is our VP of Clinical Effectiveness, and Kathy McCoy, who is our System Director of Patient Safety and Performance Excellence, who we work very, very closely with. With this, we also enlisted the help of our internal customer experience and safety team, marketing and communication, our PFACs, as well as external partners, HPI and NRC Health. In addition to this, we incorporated best practices that came from many of our sites who had their own patient experience training program. So for instance, Sentara Lee Hospital, who is one of our top performers with patient experience, had a gold standard of care class that was very successful. So just to highlight—
Cherika, one thing I want to give you credit for and just share with the team members, Cherika and the team did an excellent job of making sure that when she said clinical and non-clinical team members, that we did have different training for some of the non-clinicals that was very applicable to what they did in our organization. And some of our previous high reliability work, we had gotten that feedback that it might have been too clinical or we weren't really focused on what that team member did. And her team did a great job of, making sure that our finance team members or maybe someone in billing services had examples and training that really was quite really what they did in their role. And I think that's what helped to make this very impactful.
Thank you, Genemarie. Absolutely. So just to highlight a couple of highlights from the approach and the impact of this, we knew the importance of senior leader support and buy-in early on, and Genemarie was, so beneficial to this with getting them all on board. We used their help to help us to hold multiple train-the-trainer sessions, resulting in over 400 trainers trained across the system. And so with that, with those trainers, over 23,000 members of our team completed this 2-hour interactive class, with 95% of them knowledgeable or very knowledgeable about the key objectives after the class, as opposed to 84% before. Also, 95% of them responded likely or very likely to use the skills and behaviors taught in their jobs. And, we received tons of positive feedback. Just a couple of examples. One member of the team wrote that it was great, it was emotional, it was useful and very relevant. And then here's another favorite. I appreciate having everyone stop to remember our focus. Okay, next slide. So in addition to having great trainers, part of the success of this program had to do with the videos and the materials that were created to support the aim. So we created an empathy video based on a poem, Advice from a Patient, which featured members of our team acting in various roles. From that poem, one of the key messages in the video was, I may only interact with you once, but I will remember you for the rest of my life. And that video really showed how we are able to put ourselves in the shoes of patients and family and bring out those feelings based on our own experiences. We also produced a testimonials video, which was very popular and features many members of the team, including our very own Genemarie, where they shared profound insights and stories on why Because We Care is so important. So the other thing, we wanted to make sure that members of the team had the key behaviors to apply immediately, and that they also had an opportunity to commit to doing those behaviors every time with every patient. Next slide. So to keep the momentum going with the Because We Care training, key skills and behaviors and expectations will continue to be reinforced, not only in new employee orientation, but through monthly education for all members of the team. And this includes things such as monthly resources with a safety and a service focus using Learn, Apply, Share, and also access to a digital hub for resources and to kind of keep everyone up with program updates. One other thing I want to mention with this is with this continuous learning, we knew that it was going to be important to adhere to guiding principles supportive of adult learning. So, with the learnings, we make sure that a story is included as part of the learning. We make sure that the learning is intuitive and easy to understand and takes no more than 15 minutes. It can also be customizable for groups or self-learning. And it is, again, applicable to all members of the team, regardless of their role or healthcare setting, and that it is complementary to other Sentara initiatives. Okay, next slide. So still with the focus on member of the team engagement, I want to tell you more about the WOW Moments System Electronic Employee Recognition Program that we launched in 2018. So first, I just want to highlight a couple of things that bring to light the tie between staff engagement and customer experience. According to the Barrel Institute, employee engagement is the fastest growing priority with patient experience since 2015. And also research that's done on gratitude and appreciation demonstrates when employees feel valued, when they have high job satisfaction, when they're engaged, when they're motivated to do their best, they work toward achieving the organization's goals. And so this WOW program was created with all of that in mind. To highlight on a couple of the benefits, the WOW program provides immediate feedback to recipients and their direct manager, and it also encourages interaction across divisions. So for instance, it is easy for a member of the team at Sentara Medical Group to send a WOW to a member of the team at Sentara Norfolk General. From an impact standpoint, there have been over 90,000 entries across the system recognizing members of the team. And also with our 2019 Employee Engagement Survey, it showed performance above the national defined peer group in satisfaction with recognition, work is meaningful, work makes a real difference. And so we do feel that, the WOW program was a contributor to those amazing results. Okay.
So this is Genemarie. I want to give Cherika a lot of credit for this because she really did make it easy to use. We had just great support from our IT colleagues, and I do want to emphasize that customer experience and our experience is truly teamwork. And we've had great teamwork with our quality and safety colleagues, our hospital and division presidents. It really takes everyone working on it. Our IT colleagues were a pleasure to work with on this program. The slide in front of you kind of gives a quick snapshot of the program's ease of use and just how quickly you can send a meaningful recognition to any Sentara employee, and as Cherika emphasized, system-wide. The beauty of the program, though, is not only does the recipient receive that recognition and a certification, but their immediate supervisor receives it also. There are so many examples across our system of how WOW recipients are further recognized. For instance, some departments have WOW boards where they post the certificate so it's visible to their customers. There are also quarterly top WOW recipients recognized. What is unique about this is our actual PFACs choose the quarterly winners. So they're involved. Again, our patient and family committees are involved. They also receive a small token of appreciation and are many times presented with the top award by senior leaders in their division. It really has become part of our culture here, and you can hear people say, hey, did you get wowed by someone today? So that wowed word is now describes something that comes to the employees. And there's also a lot of excitement, and it really makes your day when you get a wow. I also will tell you that Howard Kern, our CEO, and some of his presentations have used some of the stories from WOW. So the other piece of it is you can go in at any point and really read some of the WOW stories, and they truly are inspirational and truly are just watching our team members with gratitude recognize other folks. So I want to give a lot of credit to Cherika and the team for making it easy and obviously, as you've seen by the results, very usable. Next slide. So in moving on to the leadership foundation, it cannot be underestimated for us the importance of effective leadership and creating that culture of always for customer experience. So we were fortunate enough to be able to partner with the Studer Group, and we have a program that's called a Sprint program that's underway in several of our hospital divisions where we really start to incorporate and learn, again, the evidence-based skills that you need to have, and we develop those together. And we also validate the coaching of our employees. And so we want to say thank you to the Studer program. They really have assisted us with honing those evidence-based skills. We also have started a coaching program for our customer experience leads. We have one for each of our divisions, and we're working with Studer, and it's based on a coach-the-coach model. And our aim is to train our coaches across the system, so when Studer is no longer working with us, we have people that we have trained that can really instill and lead us in the Studer principles. Our Because We Care culture of always for leaders, and you can see one of the tools on there, and alignment. All levels of our organization have the same sense of urgency regarding experience and quality. We connect the dots so that every member of the team really understands the why, and that's been, I think, critical for us, is people understanding the why of why we do this. Also, we emphasize consistency. Every customer should have a consistently good experience no matter what department, day, shift, or leader or staff member they are working with or encounter. And then probably the biggest one for us has been accountability and instilling that accountability. There's leader rounding on all of our staff, and we actually audit that and they have to turn that in. There's nurse leader rounding on all patients, and every service line has a standard for patient rounding. And then we also have a process for weekly direct observations and validation that people are really doing what we've asked them to do. And that validation includes our staff. It also includes our leaders, and can also include our executives. So we really try and make sure that we are all experts and really coaching and doing what we need to do to ensure that we're meeting the principles. Next slide.
Okay. So lastly, we want to talk with you all a little bit about important efforts that are underway to support effective use of data, okay? So the first is our new Tableau Customer Experience Dashboard. So we are so excited that we have Jasmine Redwood, who joined our team this year as our Enterprise Analytics Consultant under the direction of Dr. Kathy Zimbro, who is our Nurse Executive for Research. And so I just want to say that the work that Jasmine and Dr. Zimbro have done is extraordinary. And it is clear with this dashboard that it gives us pertinent information at a glance. So a couple things you can do. You can take a 3-month, just by the report you see here, a 3-month look back on where we are by division. We're reaching our yearly goal. And so then you see highlighted, if we click once more, it allows the ability to drill down by division and see progress year to date, as well as taking a 3-year look back at progress with achieving the yearly goal. And so this is something that our executive team will appreciate and rely on to keep their teams focused on really what's important, improving the experience of care as evidenced by our scores, among many other measures. Okay, next slide. Okay, Genemarie.
So this kind of brings us to our second measure to support effective data use, because one of the things and I think everyone on the call can relate to, HCAHPS does give you some information, but understanding HCAHP and what the factors are that really can drive moving that score is something that we really wanted to push on and figure out, could we get an even better understanding. So I'm sure many of you can relate to the fact that we have divisions that perform exceptionally well in customer experience. Some of our examples are Sentara Martha Jefferson Hospital, Sentara Princess Anne Hospital, Sentara Lee, Sentara Williamsburg Hospital, our hospice division, our Sentara medical groups, and also our health plan, Optima Health. But we also recognize there are divisions that that need a little bit of improvement or need some focus on that. So we again enlisted the help of Dr. Zimbro. And Dr. Zimbro and her team of researchers really took some data and drilled down over 3 years to look what we can learn from our patients and really understand what matters most to them with patient experience. So Dr. Zimbro and her team set out to explore the significant predictors for patients giving us a 9 or a 10 on the HCAHPS overall rating of hospitals. So we had a very thorough analysis, and we were able to see just how impactful nursing care and communication is, and how the nurses play a more prominent role in the patient perception of care. And when Dr. Zimbro showed this to our nurse executives, you could see them like, wow, we've always heard this. Well, this was the proof in the pudding, because she really highlighted the 3 top scores and the 3 top indicators of impactful care that were different for each facility. And so I think that really helps them to understand their role. And our plan is to continue to dig deeper into this analysis and explore the influence of hospital and patient characteristics. So we continue on that journey to see how we can improve our scores even more. Next slide.
Okay, so this is our opportunity, as we come to the end of this presentation, to give a huge shout out to 3 of our Sentara hospitals who were recognized in 2020 as Outstanding Patient Experience Award recipients by Healthgrade. So shout out to Sentara Lee Hospital, Sentara Martha Jefferson Hospital, and also Sentara Princess Anne Hospital. Okay, next slide. And so we want to thank you all so much for participating in this webinar and learning more about our design, our strategies, and also our tactics that help us as we move along our journey toward customer experience. And here you have some contact information should you wish to reach out and learn more about potentially implementing any of these tactics at your site. And so we thank you again, and we now open it up to any questions that you may have.
So Genemarie and Cherika, that was absolutely wonderful. Great work. Thank you all for sharing around the state. I'm going to quickly look into our chat box to see if there are any questions at this time. So I see one. It says, can we obtain a copy of the slides to share with coworkers? And I'll go ahead and respond to that one. Yes, we will post the slides with the recording on our VHHA website. That probably should be up by Monday of next week, so that will be available. I don't see any other questions at this time, so I'll go ahead and turn it over to my colleague, Carrie Brady, who will lead us through some polling questions and discussion. I will continue to check the chat box to see if there are other questions for our colleagues from Sentara. So
Thank
Carrie,
you, Abraham. So
perfect.
we say this, thanks. We say this every month, that we remind everybody at the end of the presentation what the foundations are. And the really rewarding and amazing thing about today's presentation was how they have focused and aligned all four of those foundations. And there are so many ideas embedded in today's presentation about how you can do that. But really, when you look at these foundations and you bring them together, every time you are working within them, you are amplifying the effect in the other area. It's additive, and the cumulative effect is much more than those individual initiatives when you're not working in all four areas. So thank you for so many great examples today about how you embed different activities in these four areas. We had a couple of questions that we wanted to ask you today because, you know, 2020 has thrown us a few curveballs, and we asked you, at the beginning of this year of patient experience, we asked how people were feeling about their foundations and where you needed the most support, but we thought now might be a good time to revisit that since some things have changed. So first, we wanted to ask you, how many of these four foundations do you feel are solidly and sustainably in place in your organization? And this is really related to patient experience efforts specifically. So do you feel that you have your leadership, your members of the team engagement, patient and family engagement, and effective use of data? How many do you think are solidly in place in your organization? And no surprise, the next question we're going to ask you is about which one you need the most support with. And we ask these questions because as we're looking forward about how VHHA can best support you in these efforts, we want to see where we need to place more emphasis going forward. And this research on the foundations has come out of many different activities. Okay, so 2 and 3 are the most common answers that we have here. And then we have some that, you know, are 1 and some that are 4. One thing that I would encourage you to do as you think about your foundations, when I was going around and doing HCAHPS workshops around the country, and we did them with AHRQ in 26 states, so it's a pretty representative of the country experience. The thing that people were never talking about as a team was what was their strongest foundation. So I would encourage you to take a look when you're saying, if you don't say you already have all 4 that are strong and sustainable, instead of focusing so much on where is your weakest foundation, take a look at what is your strongest and how do you build off of there. Because in healthcare, very often, we have a tendency to look at what we need to fix, and it is important to look at what we need to fix. But we sometimes miss opportunities of building on what we already have because we're so busy focusing on the areas that we need to fix. So the next question that we wanted to ask you is, where do you feel that you need the most support from VHHA? In which of these 4 foundations do you need the most support? Now, at the beginning of the year, the answer to that question was on staff engagement, members of the team engagement. And so that's where at the beginning of the year people were saying they needed the most support, but we'd like to just do a check-in right now to just see how you're feeling about that. It is something that has for years until fairly recently been overlooked. The relationship, and I think Sentara did a great job today of articulating it and really highlighting the relationship between when you're engaging your team effectively. The data is very powerful about the results that happen there. If you engage your team effectively, if they know what their why is, how this connects to their mission, how they connect with each other and what they're bringing to work every day. And as Sentara said so well, when you make the training relevant, especially to your non-clinical staff, so they have examples that they understand how they show up at work, it makes a tremendous difference. So here again, we see staff engagement is the runaway, actually even more than before. But here's the interesting thing from the change in the data. Patient and family engagement, in terms of it benefiting from the most support, is way down compared to where we were at the beginning of the year. So that means that based on those of you on the call today, you feel that you're engaging your patients and families more now, or at least that you have you need less support in that area, which actually isn't surprising, I think, due to COVID, because in some ways, COVID has forced a different level of engagement with patients and families because of the nature of you needing to partner with your communities, even to just bring people into the hospital to help orient them to new issues. And I also think it's brilliant what Sentara said earlier about that video, which will be fascinating to go watch. It looked like it was a hyperlink. That video direct message to the patients and families on admission from leadership about what the situation is. So it's a great way to connect. So as my sort of parting words here before we see if there are any more questions, really alignment is so important. And 2020, we've had many challenges, but they do present these unique opportunities to strengthen these foundations together and improve alignment, because you're working in a new situation that you haven't seen before with the pandemic, and everyone has had to adjust in some ways to the pandemic. So as you are considering what you're taking forward from this experience, you can look at those foundations, and it's an opportunity to reconnect. Even as we heard with the PFACs, when you're doing that virtually, that opens up opportunities for some of your patients and families to participate that would have a very tough time coming to an in-person meeting, either because of the nature of their medical conditions or of their other responsibilities. And so it does present opportunities for you to engage other people in the community, perhaps that were tougher to reach in your prior efforts. We heard a lot today about, embedded in here, about sustainability and how this is being reinforced, everything that is being done through the rounding and through checking and validation and all of that. This is something, you can't just roll something out and expect it will continue. I know everybody knows that, but when you've got that alignment around the purpose, then it's much easier to have that reinforcement, and especially when you're starting with why. And I like to think of this as your team at all levels, from leadership to your frontline staff, clinical and non-clinical. Everyone, particularly in 2020, has been overwhelmed with lots of different things. And it's kind of like throwing pebbles in the water. You just have a lot of things that are coming at you. When those efforts are not aligned, I like to say that it becomes a flat line for your staff, because they get so overwhelmed and exhausted, every member of the team, that after a while, it's hard to respond no matter how many things are being thrown in the water. Only the really huge things are going to get addressed, because it's just scattered efforts. But if you get this alignment like you have in this image and like we heard today, then what happens is everything is building on everything else. So it keeps coming back to your principles. It keeps coming back to your why. And it becomes much easier to achieve the results because you're not scattering your efforts. So, so consider in your organization, for those of you that don't feel you've got all four kind of lined up and in place sustainably, consider, even if it's taking small steps, at how do you begin to promote that alignment? And there's lots of different ideas that come out of today's presentation, as well as out of some other ones. And if you have questions, we can talk more about that, but just keep thinking about how you align those efforts, because that's how you're going to get the really amazing results. And thank you to our presenters today. You both did an amazing job, and it's so inspiring and exciting. So now, Abraham, I'll turn it back to you, see if we have questions now.
Yes, we actually do have a couple of questions in our question box. The first question was for the Sentara team. Are you able to speak to how you're feeding your patient experience data into Tableau?
Jasmine, are you on the line?
Let me see if I can find her and unmute her.
Can you unmute her? Or Kathy Zembro?
Let's see, Kathy Zembro. Kathy's unmuted. I'll find Jasmine.
Hi, everybody. Yeah, this is Kathy Zembro. Sure, I can speak to that at a high level, but feel free to reach out to either myself or Jasmine, and we can go into more detail. So we extract the data and we curate it, and then we leverage that into a file that then can be imported into Tableau. And then Jasmine works very closely with Genemarie and others, Cherika, to visualize the data in a way that it makes sense for them. So the data are there. It does require a fair amount of curation on our part to putting in a landing area to then import the data into Tableau, which is a software that's available for folks. Jasmine, you have anything to add?
No, you covered that perfectly.
Okay.
Thank you.
You're welcome.
And then the final
We're
question.
more than happy to share best practices, at least to the point that that we have found that makes it work for us.
Excellent, excellent. And we have one final question. Let's see. What sort of roadmap did you use to implement the foundations? Were there phases?
Cherika,
Hi there, this is Cherika. Yeah, sure. I'll speak to that. So I tell you, as probably one of the best things that happened was just that we had access to that Patient and Family Experience Improvement Guide that VHHA developed, and we found, kind of like these foundations. And so really and truly, we touched on just a couple of things that we wanted to talk about, but there are many things that kind of we already had kind of embedded in all of those foundations. So what I would say is, as far as the roadmap is concerned, I would kind of start with what you are presently doing, and almost like list them out in each of those 4 quadrants, and then start to figure out how you can connect the dots. And so the reason that visualization helps as you start to create a roadmap is you'll be surprised how many things that you currently have in place, and it's a matter of, again, aligning them together or either figuring out ways to enhance. So in regards to the roadmap, I would say start where you are, and then work with a team, and definitely get feedback from your patients and families in regards to how to enhance.
And Cherika, thank you very much for that response. And I will also note that we do still have that VHHA patient family guide available on our website. So the resource that she's referring to is still available on the VHHA website. Simply go to the website, go to quality and safety, and then there's a patient experience tab on the website, and that resource is available there. Well, it looks like we have no other questions. We thank you all for being with us today. Thank you again to our colleagues, Genemarie and Cherika from Sentara, for sharing the great work you all are doing. Thanks to everyone who's presented throughout this year, our 2020 year of patient experience. Our final webinar is scheduled. It will be on December 3rd at 12 noon. And our presenters will be our colleagues from Inova Health System, led by Mr. Sean Smith, their Assistant Vice President of their clinical enterprise and their leader of their patient experience efforts. So please join us next month for our final webinar of the year. Again, thank you for everything that you do to make sure that the members of your community have an ideal patient experience when they come to your Virginia facility. Hope everyone enjoys the rest of your day, the rest of your week, and look for the information posted on our website next week. Thanks very much. Have a good day.